Well, good morning. It's Sunday morning. It's a lovely day, so I'm in the garden. Just behind me you can see one of our apple trees, and I'm afraid these apples aren't keeping me away today from you, but this is my heart-to-heart talk for the telemedicine group today, and I had some very good feedback on the pacemaker article I did, and it made me think of all the patients that come to me who've either been told they're going to have or have had a bypass, and numbers are always raised. I've had 2 or 3 or quadruple or triple bypass. Does it matter? Is it a competition to see who's had the most? What's happened? Why have I got 3 and he's got 2? Well, I thought it'd be useful just to do a little demo here. So I've got my famous model of the heart, which you've seen before, and I put some bypasses on it. So you've got the aorta at the top in the red, and this yellow one is actually replicating an internal mammary artery that normally goes to the inside of the breastbone, and if you see, it's going down to that red one down the front of the heart. So that's a left internal mammary artery that's going to the left anterior descending, known as a lemur. If it was done from the right internal mammary, it would be called a reamer. And the black ones are veins that have been taken from your leg and reversed, so the valves are operating the right way and don't block flow. And you can see there's 3 different or 4 different black ones there, and I'm going to explain why there's different positions. So this person has had 1 left internal mammary artery and what looks like 3 veins, so what we call 4 top ends of mammary artery and 3 veins, but in fact they've had 5 grafts in a sense. And the reason is, if you can see the one with the dog leg, it's going to an artery here and then it's moving across to an artery here. So what this patient has had is 1 artery to an artery, a vein to a side branch, a diagonal, a vein to a side branch, and a jump graft across to another vessel, so it's 2 in 1, and a vein to the posterior descending of the right coronary, which runs around the bottom of the heart. So this person's had a quadruple bypass, but in fact 5 vessels have been bypassed. So this is why the numbers change, and the reason you have different numbers is because it depends on what the angiogram has shown in terms of your anatomy. So if you haven't blocked one, you don't bypass it. Or if you've got disease which isn't critical, if you put a bypass on, the flow down the natural vessel will compete with the flow down a vein, and it'll probably close off. And about 10% of them close off over the first few years or so, and over many years people can lose them, but many people can keep them for life. The one that lasts the longest is the artery, and that's why an internal mammary artery is used as a first choice. If you want to use both, you can. There's a risk to the sternum healing, particularly in diabetics, so that's a caution there because it's producing the blood supply to the sternum. Or you can take an artery from the arm, a radial artery, take it out and do a pedicle graft like a vein. So that's a little summary of bypass grafts, where they might go, why you have different numbers, and the reasons for putting the bypass in the first place is because of the anatomy you've defined. So I hope that's helpful, and there'll probably be a Facebook Live coming up on this topic in the future. So enjoy your Sunday. Goodbye.